everybody, I'm Melissa. If you don't know me, I'm a pelvic floor physical therapist and I work a lot with pre and postpartum women. And today I wanted to get on and talk a little bit about how your pelvic floor and all the muscles that are involved in your pelvic floor can impact your back pain or vice versa. So any sort of pelvic floor issues that you might having, like if you're accidentally peeing yourself while you're at your workout, or when you're lifting your kids, or when you cough and sneeze, that sort of dysfunction might also have something to do with that back pain that you get. I get a lot of patients who come in to me for pelvic floor physical therapy who are talking about all of their pelvic floor issues, and when I ask them if they have any history of back pain, they usually kind of brush it off, like, no, this is kind of normal. I get some back pain here and there, but I'm getting older, or whatever it may be. And I just don't think that people realize that those things all go together. I really try to look at my patients as a whole person, and I can't just look at your pelvic floor and not look at everything else going on around it, because all of the things around it are going to impact your pelvic floor, and your pelvic floor is going to impact all of the things around it. So let's talk a little bit about your pelvic floor. So last week or a couple weeks ago, I wrote a blog, What Exactly is Your Pelvic Floor? If you want to go check that out, I'll put a link in some of the comments. But your pelvic floor is all the muscles that sits between your sit bones, or that bones you sit on right here, your pubic bone in the front, and then your tailbone in the back. So all of these muscles are considered your pelvic floor. Like I said in my blog post, there's 3 layers of pelvic floor muscles. The outer layers are really more geared towards leakage and continence and sexual function and things like that, especially clitoral function. And the deeper layer of muscles are really what I want to talk about more so today, because of their role in stabilizing your pelvis and your back during movement. So I'm going to remove the outer layers of my pelvic floor on my model here, put them over to the side. So the first thing I wanted to talk about is how the pelvic floor connects to not just the pelvis, but actually your back too. So if you look here, this is the back of your pelvis, okay? So this middle bone right here is called your sacrum. And then your coccyx is your tailbone right here. If you see, and I might move my pelvis a little closer here, you can see that these muscles all attach right to your tailbone and actually onto your sacrum. So all of these pelvic floor muscles here have attachments onto your sacrum as well as to your pubic bone, and they're going to impact how these joints right here move and function. So beyond just that direct connection to your lower back bones and joints, we also have a muscle, which I kind of posted a little bit about. I shared a post from Pelvic Guru the other day about your obturator internus, which is actually a hip muscle. That muscle, which we can palpate a little bit easier internally than externally, can have a lot of effect on both your pelvic floor and your lower back and hip pain. So that muscle, if I can show you in my pelvis, is, let me see if I can get a good view. Okay, so this muscle right here is actually your obturator internus, or a hip muscle. All of these muscles here are your pelvic floor muscles, or your levator ani, the deepest layer of your pelvic floor. So this line right here is actually called your arcus tendineus, and it's a direct connection between that hip muscle, hip rotator muscle, and that pelvic floor. So any sort of dysfunction, you can see that any sort of dysfunction in your pelvic floor might be affecting that muscle, and that muscle might be affecting your pelvic floor. It's hard to say what one is causing the other, but most of the time we got to fix both things and figure out what's going on to get your back pain and your leakage and your pelvic pain better. The other thing I wanted to quickly mention is Kegels and your pelvic floor function, and how that is going to be impacted by your back pain. So beyond just the direct connections to your lower back, the direct connections to that hip muscle, those are 2 huge reasons that I can show you that your back pain and your pelvic floor pain are going to be related. But also your pelvic floor function matters, and your pelvic floor function is impacted by how your pelvis is moving, sitting, how your posture is, and all those sorts of things. So Many patients have a really hard time doing a proper Kegel muscle contraction. So if you've ever heard of a Kegel, it's actually a pelvic floor muscle contraction. Most people, if you're having leakage, are just going to tell you to do Kegels, and sometimes that's not always the answer, which I kind of talked about in my blog post a little bit. Sometimes your muscles are too tight and they can't get a good contraction, but that pelvic floor muscle contraction, which you may or may not know how to do, is what's going to be important in your pelvic floor, overall pelvic floor function. So leakage, pain, all those sorts of things. So how to do a Kegel. So I heard an awesome analogy the other day about your pelvic floor, how it works with your breath. Okay, so if you imagine one of those little claw machines, I don't know if you guys know me, if you know my husband, he is just a huge fan of those toy claw machines where you can like grab the toys and no one ever wins them, but my husband wins them all the time. So I thought it was so funny that this lady used this as an example. This pelvic floor therapist, I was listening to a talk last week, and she was using the claw as an example of your pelvic floor with your breath. And it's the perfect visualization in my mind of what your pelvic floor does with your breath naturally. So if you imagine that claw, on your inhale, so your breath in, your pelvic floor drops like the claw and opens. So all those muscles of your pelvic floor kind of relax and widen, kind of opening that way like the claw. So they drop and open. And then on your exhale, they actually squeeze in and lift. So that is your Kegel. So that squeeze in of those muscles and that lift of those muscles is what a Kegel actually is. So I want you to play with something for me, okay? So you're actually gonna sit there, stand there wherever you are, and see if you can get that squeeze and lift motion, like you're squeezing and lifting a marble with that vagina of yours. Or you're squeezing and lifting a bean, sometimes I'll tell people, or I will sometimes, if that's hard for them to visualize, I will tell them to try to squeeze your sit bones towards each other. They're not gonna move, but you're trying to move them towards each other with that pelvic floor, or even moving your pubic bone towards your tailbone. So you're doing that squeezing and lifting motion of that Kegel. So now, after you kind of get that sensation of that Kegel, I want you to play with the position of your pelvis. So if I turn a little bit to the side here, most people are gonna sit like this. In this, we call it sacral sitting. It's bad for your back. Everybody kind of knows that the posture gets a little bit iffy when they're sitting at their computer for long days, but I want you to play with how you feel your pelvic floor works differently depending on how you're sitting. So I want you to get into that kind of slouchy back, slouch sitting where you're kind of tucking your tailbone under. So you're getting more into this sort of position with your pelvis. So you're here normally, up and down in that nice normal pelvis position. Then you're going to tuck your tailbone under this way. So you're kind of sitting on your tailbone this way. And then you're going to try that same claw motion or that squeeze and lift motion of your pelvic floor. So you're going to squeeze and lift. I want you to notice where you feel that squeeze. A lot of times people will feel it more in the back towards their rectum or their anus, all of those posterior or the back pelvic floor muscles. Now I want you to sit up nice and tall, almost so that you're tipping your pelvis forward a little bit. So you're going kind of into the opposite motion. Okay, so you're here first, and then you're here next. And now you're here in this good posture, a little bit of normal arch in your lower back that's supposed to be there. And you're gonna do your Kegel there. So you're gonna try to do that squeeze and lift motion there. If you do the squeeze and lift on your exhale, you're probably gonna feel it a little bit better, but just trying to do that squeeze and lift there and notice where you feel that contraction. So a lot of times people will tell me like, oh, that's so crazy. I'm like, yeah, I know. So this position of this pelvis has a lot to do with how your pelvic floor functions. So in that normal seated posture with that little bit of curve in your back, most people feel more contraction or more squeezing towards the front of their pelvic floor, or more towards their urethra and more towards their vagina, or more kind of centralized in the middle of that pelvic floor area. If you think about this with your leakage, with regards to your leakage, and again, your back pain is affected by this position of your pelvis, but so is your leakage, because if you are sitting in that back position all the time when you sneeze, and no matter what, how strong you squeeze that pelvic floor and do that Kegel, all of that squeezing is happening in the back not near your urethra to stop that leakage of urine. So sometimes just changing your position so that you can get more of that front part of your pelvic floor working a little bit better, that can make a big impact on that leakage that you're getting. I hope that these little tips helped you and it's given you kind of an awakening that maybe your leakage and your back pain are kind of related, or your hip pain and your back pain and your pelvic floor dysfunction are all kind of related. If you need any help or you have any questions, please reach out to me. But again, remember, the pelvic floor attaches right to the back. It's connected to that hip muscle, and that position of that pelvis makes a difference in how well your pelvic floor is functioning. I'll see you next time.